So now we're going to talk a bit about pain management. There are many comfort measures that we can undertake, including oral pain medicines, topical or treatments that you apply directly, and also things that help numb, something called topical anesthetics. So the topical treatments or things that you can do to reduce perineal pain include things like ice packs. The ice packs tend to look like this. You can unwrap it, turn it this way until you hear a popping sound, shake it up a bit, and then it becomes cold. Some people find that this isn't cold enough. You can use at home anything you want. If you want to use frozen peas or vegetables, just put a cloth or something in between your perineum and the actual ice just to protect yourself from an ice burn. There are other topical treatments that we use, which include something called witch hazel pads, which come from the hospital in a little tub that looks like this. And they're just little pads that you can actually place on your perineum and leave them there for as long as they are comforting. So sometimes before or after the ice, we'll have you put some witch hazel pads in that area, whatever's soothing for you. If it doesn't feel soothing, it doesn't need to be done. And then lastly, there's dermoplast or benzocaine spray, which is a numbing type of spray, and it can help with some of that burning sensation that some people feel, even if they didn't have a big tear. Sometimes that can be very soothing as well. So those are some of the things that you can apply to your bottom, but also there are oral pain medicines that we often prescribe. Tylenol and ibuprofen are our first-line therapies, and we tend to tell patients to use them basically around the clock if they're needed, for sure. Oxycodone is a very strong and effective pain medicine, but we don't use it first line for perineal discomfort, mostly because it has addictive properties and it can worsen constipation. However, it is recommended at times for short courses, especially for patients with more larger tears, including a 3rd and 4th degree, when they have breakthrough pain. So if you're taking Tylenol and ibuprofen, if that's not controlling pain, then oxycodone may be used for short courses to help with that comfort.